My name's Chad Pecot. I'm a thoracic medical oncologist, so I specialize pretty much only in lung cancer and in some cases abnormal tumors inside the chest. So I chose my specialty because lung cancer is like the great white of cancers. Of all cancers throughout the United States and the whole world, it's the biggest cancer killer. And so I really kind of felt like I want to go after the worst cancer of all cancers. There's certainly other really bad cancers, but lung cancer is certainly one of the worst. And the perception of it has always been really bad, although I'm grateful to say that we're really changing that. For me, taking care of cancer patients is incredibly personal. I was diagnosed with testicular cancer when I was 20. I was an engineering student in college. I was not thinking or planning to be a doctor. And then all of a sudden, I find out I have cancer that's spread throughout my abdomen. And it was a huge shock. And so having gone through treatment, I had surgery and then chemotherapy, it completely changed the trajectory of my life. I knew from that instant I didn't want to just become an engineer, and certainly there's a lot of things in engineering that are really important, but I really want to kind of take that knowledge and move it into medicine and care for these patients that I was around. I was surrounded by patients in the waiting room. I befriended many of them, and as I got closer to cancer patients that while I was a patient, I just felt like I really want to be their doctor. And so I just had like tunnel vision, like I have to become a physician, I have to become a cancer doctor. And eventually, ironically, I brought the engineering background full circle. So now I do research as well, take care of cancer patients, and a lot of things we do in the research field actually integrates my engineering background as well. I try to tailor my approach for cancer patients for each individual patient. So I know that sounds kind of cliche, but off the bat, I go into the room and I like to meet my patient, get to know them on a very individual basis. I like to know about where they grew up, what they do for work, are they retired? I like to know about their family. And then as I get to know them and hopefully get to make them feel a little bit more comfortable, then we really kind of drill down in what's going on inside their body, and I try to make sure they understand as well. So a lot of times it's assumed they understand what's happening inside them, and we really make sure that it's clear where is the cancer. Is it in one place? Can we take it out through surgery? Do we have to do radiation? Do we have to give chemotherapy or pills sometimes for lung cancer? And then I make sure that we really understand exactly what makes their tumor tick. I'm also what you would call a physician scientist. So I take care of lung cancer patients, that is my specialty, but I also run a research laboratory. And so that's really a huge passion of mine, is not only to be caring for the patients, but to think about what can I do for tomorrow? How can I advance what we're already doing for them now? Everything we do for patients nowadays is using yesterday's tools. And so my excitement also comes from understanding what's going on with my patients on a deeper level and to try and bring new tools, new therapies to them.